I've had the privilege to be involved in 2 other conjoined twin separations in Memphis, Tennessee, where I trained and I worked. And when everybody says that it takes a village to do this, it's actually a bigger village than just here. So for instance, the original consultation that I had with Amanda and James came about because I got a phone call at my office, my private office, and my manager, Myra, called me and said, Dr. G, they're asking you to see somebody for conjoined twins. What is that? And I was just glad she asked because if she had just said no, that would be a problem. But anyway, I bring that up because it's so rare and it really, really takes a lot of commitment. So one of the first phone calls I made after I sat with them and talked with them, she was, I believe, about 3 months pregnant then, was, it was to Dr. Gbulie. I called Eric and I was like, hey, I need to talk to you. He was like, what's going on? I said, we have a mom who's going to deliver conjoined twins, and I need to talk to you because, one, it's going to be a big deal. We both know it's very rare, and we really need to make sure that we're going to have the institutional support to do this, because this requires a significant amount of commitment from the hospital. And when your colleague is chief of surgery, you know who to talk to. So he said, so when he said yes, then I called Dr. Iglesias, we talked. And over the course of the pregnancy, it was always interesting having a pregnant woman come to a plastic surgeon's office. You're like, what's going on here? But it was really good. I got to know them very well. I had absolutely no doubt that Cook Children's could pull this off. And I am really grateful that you guys gave us your trust and gave us the privilege, because it really is a privilege, to take care of your twins. And I also spoke with Dr. Tabor, making sure, because one of the questions that they asked when I saw them at 3 months pregnancy is, do we need to go somewhere else? And that to me was a very important question, because if you think about it, something this complex requires a multidisciplinary, multi-specialty approach, and they just wanted the assurance, especially since they knew I'd done this before, that we could handle it here. And I had absolutely no doubt that we could. I've been on faculty at Cook Children's since 2018. I moved from Memphis to Texas. And I've done very complicated, complex operations here, and I was well aware that we had the capability. And I could see the relief in their faces when I told them that. But I also told them, you know what, not only am I going to tell you that, but I'm going to make the calls, I'm going to talk to all the players, make sure that they agree with me. So when I spoke with Dr. Tabor, I was like, okay, is there any reason we can't get them delivered here? Is there any problems in pregnancy? And they were doing fantastic. So that was the first hurdle. And then when they were born, everything went well, and the neonatologist took over. And I can't tell you how amazed I am at how much the neonatologists have done, taking care of them, making sure that they were ready to get to this critical stage where they actually could be separated. They were adding weight well. They were making sure that they were getting their feeds. It's just the overall care that the nurses and the doctors at the neonatology services provided has been amazing. And then Dr. Iglesias did a very good job of being, the overall orchestrator, making sure that everybody in the team knew their role, knew what we're going. And, some like this, I'll be brutally honest with you, there is no playbook. There is no medical book you're going to open and it says, step 1, conjoined twin separation. That does not exist because of the rarity of this. So my role as a plastic surgeon was trying to figure out and anticipate what the reconstructive requirement would be for the abdominal wall reconstruction and the skin closure. We decided to use skin flaps to achieve this. We actually had a powwow about should we do tissue expansion. Tissue expansion is a process by which you stretch out the skin prior to surgery to recruit more skin. That we felt would have helped, but By the time they got to 3 months, they were literally punching each other in the face. Amy's scoliosis was getting worse. It was just getting to be more of a problem. So we went into this knowing that there was a good chance we wouldn't have the ability to completely stretch out to close the skin. However, I do feel that we will achieve this, and we did achieve primary closure in one baby, and we will be getting the other baby close too. So I think it's been a resounding success. And like I tell everybody, surgery is great, but post-operative care and perioperative care is absolutely important. So one of the reasons I'm giving the neonatologists so much props is they're the ones doing that as well. Amanda and James, thank you so much for giving all of us the opportunity to take care of your kids. They're pretty much family to me, and I will continue to take care of them. And thanks to Cook Children's for really giving that institutional support required, because this takes quite a bit of resources that's above and beyond the norm that you would need for any straightforward operation. So to the operating room team, thank you guys. You guys did fantastic. Like when we talked about this, like a few days before, the one thing I said was ego goes all the way out of the room. Everybody knows their role and everybody helps out. And you guys actually did amazing. So thank you for that. So thank you, everybody. This is Jamie.
We can tell by the spine.
Yeah, tell by the spine, absolutely, yeah. Yeah. So, and then the kidneys in the back, they were fine. And then basically the separation, let me see, this is Amy. So when they were on the table, they were kind of like this, and the separation went right through there. So.
So many days and months in the making.
Yeah, absolutely.
And I think it's really hard for people to kind of conceptualize just how much planning and preparation goes into this.
Yeah.
Could you kind of talk about just how much time and energy this has taken out of your day-to-day?
Well, you know, in my case, I've basically been involved since she was 3 months pregnant. So, and I believe I saw her 3 or 4 times during that period, or 2 or 3 times during that period. And I tried my best to act as a liaison between initially the obstetricians and then after delivery the neonatologists and the pediatric surgeons. So it's taken quite a while, but it's such a rare phenomenon that I have a mind at the least. And then in terms of after they were born, and then it becomes real. So for instance, when they were in the womb, they had intrauterine imaging which showed the anatomy, but the imaging after birth is so much better than the imaging in the womb. So it was really after they were born that we were able to get better imaging to actually assess, okay, is this something that, for instance, what if the liver anatomy was so complex that it required a center that does liver surgery or something like that. So I think we're blessed in terms of the fact that it turned out that the vascular anatomies of the liver was different and the ductal anatomy was different, which meant that we could safely do it. So it's taken a lot of time, preparation, but definitely glad to do it, and if it came up, I'll do it all over again.
Wow.
Yeah.
Did you ever imagine that you would get the chance to be a part of a team like this?
So this is number 3 for me.
Okay.
Yeah. So did I imagine? The first time was 2011. I was a fellow. It was amazing and shocking. Second time, 2016. 2016, and then now, those first two times I was in academic plastic surgery, and then now I'm in private practice. So if you told me, oh, private practice is still going to be involved in separating twins, I'd be like, how? so yeah, I really did. No.
How did this experience compare to the first two?
It's always even better, because the more you know, the more you can plan. It never gets old, let's put it that way. It's such an amazing experience, and it's such a humbling experience at the same time that it just really never gets old. In fact, I told him I'm sure we're going to do another set someday. So,
yeah. As you said, there's no playbook for this.
No, absolutely not.
I imagine, as excited as you were, as ready as you were, there had to be some sort of fear.
Oh, absolutely.
Can you kind of walk me through, did you let yourself go to those worst case scenario places?
Always basically hope for the best, prepare for the worst. The question was going to be, so my role initially was planning the incisions, making sure we had adequate skin to close, planning the reconstruction of the abdominal wall, which the general surgeons would do, making sure that everybody was on board. And that was pretty straightforward. But the other thing about getting closed would be, how are the kids doing? So there's certain things in terms of the airway pressures, the vital signs, etc., which would or would not let us close. So in this case, in Jamie's case, it did allow us to close. In Amy's case, it didn't. So yeah, I always think of the worst case scenario. What if we have some bleeding we can't control? What if we have some horrible respiration we can't? I don't think Dr. Iglesias gave himself as much of kudos in terms of separation, because there were other complex things involved. We had to separate the pleural cavities, which thank God were separate, but you had to create a plane between them and keep them separate without getting into them, so you don't get what's called a pneumothorax, which is air outside the lung. We had to separate the pericardium, which is a sac where the hearts lay, and that was so fused we actually ended up getting into both pericardial sacs and having to repair them. Now, why was a plastic surgeon involved in that? It's such a complex procedure that I served as an assistant during that portion. So yeah, it could have gone really south really fast because of the critical structures that we went through, but thank God it didn't. And you know what, like I said, assume, just prepare for the worst, but hope